tip program.
Yeah, they do like a lacrosse team.
Yeah, basketball camp for 3 days. Yeah, those kind of things. And just get your feet wet.
It's a scary thing.
And they're girls.
Yeah, I have a daughter, mine's 27 in New York City.
So Megan's, she'll be 30 this year.
Okay.
So she must graduate 2014.
2014.
Yeah, and Megan graduated in 12.
At least you guys are still in the same country with your daughters. His daughter is not in the same country.
Well, that's not true. That's
Where
that
is she,
really-
Jeff?
Oh, she came out?
Yeah.
Oh, wow.
You know, she decided she wanted to get stay away from us as possible, so she went to New York University as a campus in Shanghai. So she spent the last 2 college years in Shanghai.
Wow, was she teaching English while she was
No,
there?
well, you know, she's
Probably.
going to an English instruction is in English at NYU, but she does have the option for basically as much time as she wants to spend. She tutors kids between the ages of 6 and 12 or so. She gets $30 an hour.
Oh, yeah,
It's a
that's
pretty good
fabulous.
deal, yeah.
That's
They
great.
like a native English speaker.
Oh, yeah, absolutely. And the academic achievement, its expectation level is so high there that, you have students that are really engaged too, so that's amazing.
So then, it sounds like we've got some commonality. My daughter's heading off to her junior year abroad, which is in Manhattan this fall. So she's doing the same place her kids are.
Yeah, not a bad kid.
Well, we just love,
We
we,
love visiting.
yeah. Well, UNC has a campus, an actual campus in Florence, and so that was also a really nice and attractive.
Mhm.
And it also was paid for, which is
Oh,
nice.
wow, that's good.
That full ride included the year abroad plus
Right.
plus some, so that was nice.
So did you get your little red convertible then with all that money saved?
I did not, but I gambled on a private school for high school with the expectation. We live in Alabama. There are not a lot of public school options for youth that are at a really high achievement level, and so I actually moved and put it in a college prep, which ended up being the right thing to do for her, but it also earned her a lot of opportunity for college, and Chapel Hill was absolutely the right fit. But yeah, the dorm, it was great. Again, another comfort level. They had a dorm owned by the university and staffed by the university, so there was some comfort in that too. So you gotta advocate for all those things.
Yeah, so I have a key question. Did Florence involve student housing sufficient to let you stay in it? And what about New York also? Although that's no longer student housing.
Well, Airbnb has changed the face of the world.
Yeah.
You know, I mean, when I go to New York, I don't even stay in hotels anymore. It's just not even, there's, so. And her, I'm sure I could stay with her. I guess I'm just not in the habit of doing that anymore. But Florence offered some opportunities for visiting families. She lived in a dorm for just a very short period of time, and then the university has some flats, and she actually moved in with several roommates into a flat. And so they were close. They were just past the Uffizi, about 6 blocks from the
Wonderful.
area. Yeah. And Lord Ryanair, the things they don't tell you, the $35 flight to Barcelona on Ryanair, which she told me about after she went, which is probably smart. But anyway.
Yeah, you said you're not in the habit of staying with her anymore. I was going to ask, is that you like your freedom and independence?
Well,
Yes, yeah, I've mostly been doing grants management for the past 10 years. So then anything else, I'm now in a grants policy office in our department.
You're not recording it, are you? You're not recording it?
Yeah.
Oh, you
Yes,
are?
well,
I'm still saying hello.
yeah, so we are, and I'll do it after. Work with the person like 5 a.m.
Sounds like you've been what's great.
Distinction from maybe get the policy officer or is up there
Yeah, that's
versus
my
just the beginning.
It's a big Santa Fe. My favorite.
Yeah, historically, it's been somewhere in the
house
house.
down
And that the intention is for all to stay. Yeah, absolutely.
Again, I love it because
Exactly, yes. Yes, we're working on all
you guys can get hot as all. Well, compared to home, this is a matter. You know, the closer you get to the golf course and
Yeah, I live in like
but it is miserable. And you just walk across the street and you feel like you just,
Well, even just in GMA, it was about 15 degrees
it wasn't bad. And there were some very pretty days. We had the breeze on these streets. So as I came and I got way out.
Yes.
I guess this is my last one.
That's exactly. Yeah. And, right, and the evidence-based is a big part of this.
next to
What's that?
Maybe they're just supposed to, but it was 2 more years. I don't remember.
Well, 2 more years in the same town.
Yeah. Yeah. Actually, that's a pretty good sign.
Yeah, it was. I agree.
Welcome, everyone. It's really nice to have those of you in the room and also those of you who are listening from your computers. We welcome people from all over, not just in the room, so thank you, and I hope you'll have questions for our panelists later. I'm Kathy Newcomer. I welcome you to the George Washington University. I am the director of the Trachtenberg School of Public Policy and Public Administration, which is the Center for Public Affairs Education at GW. We have all graduate degrees in Master of Public Policy, Master of Public Administration, a PhD in Public Policy, and Environmental Management Masters. We have, from the beginning, felt that grants management is a very critical topic for all public servants because over $700 billion of the federal government goes out in grants. In a very complex intergovernmental federal system like ours, all kinds of real interesting challenges arise. And so it's a topic that we could talk about for many, unfortunately, probably many years. I don't think that the issues or challenges are just going to go away. So we'll have a lot to talk about. So thank you for being here. And I'm going to introduce my partner in this, Jeff Meyer, who is from REI, our partner in hosting these breakfasts. Welcome.
Thank you, Kathy. A number of you are familiar faces, so you've heard a little bit of this before, but I think we always have some new folks. We tried to work together with George Washington University to help create and strengthen a community around grant management so that folks who are both making grants and receiving grants have someone they can turn to, someone else in this room, so you should get to know your neighbor, who may face similar challenges and perhaps has already succeeded at them or perhaps has some great ideas about things maybe that didn't work, from which you can learn from each other. So every other month we try and have a different topic. I encourage you to suggest topics or speakers or agencies that you would like to hear from to be able to kind of, again, expand the capabilities and the success of the government in making grants and essentially kind of funding things at a local level where the funds may not be available at that local level but are provided by a higher level of government. I want to say kind of 1 or 2 quick things about this panel. I want to offer just a brief bit of background about REI and then we'll kick it off. This panel in particular kind of arose on a spur-of-the-moment conversation about 2 months ago where we were providing the results of an annual grants management survey, which I hope many of you responded. And one of the questions that federal panelists said is, you know, I'm not really sure what it is that is causing so much energy and time to go into compliance and administrative requirements. I want to know more detail about that. And I'm afraid that as a federal agency representative, I can't go out and talk to more than 9 people at a time. OMB limits me in doing that so that I don't burden folks. And so I don't have a really good picture. And so at that stage, together with the National Grants Management Association, I suggested, well, let's get together and have a focus group. And so we did that. About a month ago, we had 25 folks at the National Grants Management Association annual conference come together and say, roughly, what is burden? How does it affect us? What sorts of ways are there that we can imagine that either a federal grantor agency could help us reduce burden on grantees, or that we as grantees could help reduce burden on ourselves by taking action? And so the results of that focus group, we kind of organized them and sorted them, and then we identified 3 members of that focus group to come and talk to you about them. And so they're going to share some of their perspectives on both what is burden and a little bit about what to do about it in terms of putting more energy and resources, frankly, into the mission outcomes of the grant programs and less into just the administrative compliance and kind of making sure that the wheels keep spinning. So that's the purpose here today. Let me offer you, though, just a brief bit of background on 2 things that REI is doing that I think might be of interest to some of you, perhaps not. For those of you who aren't familiar, REI Systems works at the federal level with a number of grantor agencies, helping them improve their processes and use technology to work better. And we do the same thing with a number of state and local governments. There are 2 things that we're working on, though, that I think might be interesting to you. And one of those is many federal grantor agencies require reporting back from grant recipients. Some of that happens by fax or by paper or by Excel spreadsheet. So we're putting together a pilot to be able to say, let's make that possible on an automated basis and on the cloud, so that even a small grant recipient will no longer have to fill out all the paper forms, but will be able to do it more efficiently. And that may reduce, we hope, burden on both sides of the coin, the grantor and the grantee. So what's happening actually is we're kind of listening to the results of our own survey to say, what is it that can be done, and thinking about how we can jump in and fill the gap. And if those of you, if there are folks in the room who are interested and say, hey, I might like to learn more about that pilot, or I'd like to participate in that pilot, please do reach out to me or any of my colleagues in the room, such as Brady at the registration desk. The second thing that we're doing is we called it a golden ticket, and essentially it's kind of a grant diagnostic. And with 10 different measures of not so much what the grant outcome is, but how good is an agency at managing grants. I'll give you just one example. One of those is how many days elapse between the time you receive a grant application requesting a grant and the time you make an award. And what we have is a database that essentially says, you know, some very quick agencies can do that in 12 or 15 days. Others might take 250 days. And so we'll be able to say, any agency that asks us, here's how you compare against that database. Are you in the top 20%? Or are you in the bottom 20%? If you're in the top 20%, frankly, we'll ask you, how'd you get to be so good? What are some of the techniques you use? If you're in the bottom 20%, we might come back and say, you know, here are some of the things, how are you doing this? And we might then offer feedback. Here are some of the things you're doing that are different than what is done by the folks who get to be so good. So again, if you're interested, this is kind of trying to help take advantage of some of the knowledge REI has from working with a wide variety of grant-making agencies and grant recipients to be able to share some of those lessons with other agencies that want to kind of improve their own processes in contrast to perhaps their technology or their training or what have you. But enough about REI. Let me give you a quick overview of kind of what's going to happen this morning. We're going to have a little bit of a presentation on each of about 8 or 9 different topics. And when I say a little bit of a presentation, what did we say, like 3 minutes, 3 or 4 minutes? And it's up to each of our panelists. Our panelists have conveniently and considerately agreed to make sure that all of the major topics that were raised during that focus group a month ago, one or another of them is willing to address it. So what I'm going to do is I'm going to ask our panelists to introduce themselves. There is a little bit of rhyme to the reason to the panel, which is we have a person who, you'll find out in a moment, is a state government grant manager, both receiving grants from the feds as well as passing through and making grants to local governments. We have a person who is representing an organization that is primarily a receipt of pass-through grants, and another that receives primarily, but not exclusively, direct grants. And these are all folks, again, that are grant recipients here to talk with you about the variety of topics, those 8 or 9 topics, that panel thought were the most important topics in reducing the administrative compliance effort and reducing burden on grantees. So let me tone it down a little bit and ask maybe Lisa if you would like to introduce yourself and then continue across the table.
Okay, hi, I'm Lisa Maher. I am Director of Grants and Contracts at Children's Aid Society. We are headquartered in Birmingham, Alabama, with 6 satellite offices that cover the entire state. We're 107 years old, have been primarily funded for many of those years by United Way and direct donations. We've expanded our portfolio in the last 25 years or so to include many state contracts that are passed through of government funding, and then one direct HHS grant that I manage. So we're a small federal, direct federal partner, but we still have managed that program for 22 years, and so we've seen it progress through several stages of paperwork and accountability. But I've been in the grant world about 20 years and have been fortunate in the last few months to have been included in a couple of beta studies and to have met this group at NGMA to share some of the, we'll call it burden because there is burden, but also, quite frankly, some of the successes that we have. We plowed through that or else we wouldn't get the funding. And we are accountable in a variety of ways. We serve more than one master usually with each funding opportunity. And so we juggle, and as a grant professional, I'm promising what the direct service staff will deliver. And that partnership between what we write to the funder and what we deliver at the direct service level is critical to making, to maintaining your funding, but also to making sure that the funder achieves the actual outcomes that they want. So we serve as a bridge, and I enjoy what I do. And we're not here just to tell you about the burden. We are here to thank you a lot, or to thank the agencies that we work with for their intention to improve the process. So thank you for being here.
Just out of curiosity, Lisa, is there anyone other than you as an individual that does the grant applications and grant reporting? Or are you it?
I'm in it in terms of the contracts. I manage grants and contracts, which are direct from the funding source. We have a luxury of being a nonprofit that also has a development director that is donor facing. I don't do any solicitation or marketing presentation for any of the programs that we do, but that is a luxury. And we're in my area, generally, the grants manager wears both hats.
Thank you.
Hi, I'm Jessica Hogan. I work with the state of Nevada. I have worked with the state for over a decade and have held administrative management responsibility over grants in several different agencies, both health and human services as well as education. Currently I work with the Office of the Chief Information Officer for the state, so now I'm in IT focused, and have worked with many different grantors, have worked with multiple grantees, both at a local government level as well as nonprofit pass-through subrecipients, and several different programs that are managed with that federal funding. That's about all I have to say.
Nancy?
I'm Nancy Newton. I'm the manager of grants and special projects for WellSpan Health. WellSpan is, well, actually started as a very small hospital many years ago and grew as many healthcare systems are. And as I thought about it in the past week, we've actually added 4 health systems or acquired 4 health systems in the past 4 years for WellSpan. So we now cover 5 counties. Our budget is $2.5 billion. We have 1,500 employed providers. We have 170 different locations for patient care, 8 hospitals. As I said, 5 counties. We just have grown exponentially, which is, as you might imagine, very challenging to our 19,000 employees. We also have 19,000 employees. And I often joke that they all know who to call when they want money. So I started at WellSpan, though, as development director when it was much smaller. And then about 10 years ago, I moved into the grants officer role, and now grants manager, or manager of grants and special projects. And of course, special projects is, as you might imagine, anything else that can be assigned. But it's all good and it's all fun. So.
Great. Thank you all for coming. So we're going to go through, again, roughly 9 different topic areas, and we'll spend a little bit of time on each. I think that after kind of a few introductory remarks by the panel, we'll certainly be happy to have your questions, and don't be hesitant to speak out. Let's see, so we'll start with grant recipients actually do appreciate partnering with grantors, and so although a number of the comments throughout this may be a little bit critical, we wanted to start out on a positive note and share a little bit of substance about what that positive appreciation is.
Absolutely. I volunteered for the Susie Sunshine role this morning. So again, echoing what Lisa said, we do appreciate all that you do to help us get our grant funding, because it really does make an impact in our communities. So despite, there's days when you think of compliance and the auditor's there and there's all these regulations, and it gets really very discouraging for us, as I'm sure sometimes it does for you. But when you stop and pause and think about the impact on our organizations, that really does make it all worthwhile. For our healthcare system, we see our federal grants as helping us to fulfill our mission, to expand the mission, to serve people we may not have been able to serve without the funding, or to serve underserved populations. And quite honestly, being in healthcare, some of our federal grant programs are actually saving lives, which really makes it all valuable to me as well as to our organization. So as I said, we're a huge organization with a huge budget, but really our grants, our grants budget, we might have $5 or $6 million worth of federal grants in each year. And in fact, at the NGMA conference, I was telling someone that, and she said, well, why do you even bother doing federal grants? So, and it gave me pause, but really my organization and my philosophy is that, healthcare systems are so pushed to get new capital equipment. We're acquiring new health systems. We've got to have the latest and the greatest. We've got to be able to attract patients. We've got to be able to see patients in the same day that they call. I mean, there are so many demands on healthcare systems that to do something new and innovative, reaching out into the community or into population health, it's expensive, and it takes not just money, but staff resources, and we just don't have a lot of that. So for us, a federal grant program allows us to be innovative, to try something new. It kind of forces us to work with other partners in the community, which we should be doing. And one of the things I love that it does is that it also makes us stop and think about what are we going to measure, how are we going to measure the success of this program, which I don't think comes very intuitively to most people. So one of our, the other interesting things that our federal grants, RFPs, I see happen in our organization, I spread across the 5 counties. I serve the entire region. I have one grants officer who works with me. And I start hearing like certain issues bubble up, things like trauma-informed care, adverse childhood events, things like that are starting to pop up, and what are we doing about it? And someone over in behavioral health talks about it, and then someone in a physical health practice talks about it, and someone who's serving the underserved talks about it, and we talk about it. And so I keep hearing it, and then as I look at my grants.gov listing every morning or every other morning, all of a sudden I'll see something pop out for trauma-informed care, and that's what is the catalyst then for me to have people come together and put together a program around it, instead of just in these isolated sections. What are we doing as an entire system to address this issue? What are the steps we can take? What's the plan? How are you going to measure it? And that's a large part of the value of us putting together a grant application. And thankfully for me and for my keeping my job, we often say, well, even if we don't get the grant, which we hope we get the grant, but even if we don't get the grant, we've actually brought everybody together and created a plan that we know we can implement at some point, maybe not as quickly as we wanted to. So that is one of the great benefits for us of our federal grants. One example I have is 2 years ago, our organization had one small practice that addressed substance abuse. We had no addiction strategy at all in our organization. And as you might know, Pennsylvania is a state with a high mortality rate from opioid overdose. So 2 years ago, we were able to get a federal grant through the state. It was $1 million, which of course perked me up right away. So we were able to add support staff and training, and we were able to train our providers. We have 1,500 providers. We only had 10 at the time who were actually waivered to be able to prescribe medication-assisted treatment, which is medication plus recovery support plus counseling, and it is a best practice to help people get off of opioids. So that was so transformational for us. It was a very short grant period, 7 months, during which we learned and we quickly created models, and then we applied for SAMHSA grant for 3 years to continue that. And so we are now at, we have 73 prescribers that can prescribe these medications. We have over 700 patients we've worked with. Our eventual goal would be to have sort of a no wrong door approach where no matter where you go in our health system, if it's urgent care, the emergency department, to your primary care doctor, someone is going to be able to help you that day with your opioid use addiction. And I did ask one of our grant-funded positions, we have a recovery support specialist, for patient stories. And she told me about a gentleman who is currently on medication-assisted treatment. He was in prison 2 times because of drug charges in the past. His addiction runs very deep on both sides of his family. He was battling on his own for the last couple of months to stay clean, and he realized he needed help and reached out to get the medication-assisted treatment. He's just had his 3rd child. He was really afraid of hitting rock bottom again, and he wanted to reach out before hitting rock bottom. So he is on, as I said, medication-assisted treatment. He says he has finally put his kids first, food, shelter, and having their father at home instead of in jail. He has a steady job, home, and a long-term relationship, and without the medication-assisted treatment and everything that goes with it, the counseling, etc. He said he would be focused on getting drugs, focused on himself, and just going down a bad road again. So for me, I mean, I multiply that by 700 patients we've served. There's all different stories. There's so many different stories, and I know for sure that we have saved lives because of this grant project.
So I heard kind of 1 or 2 things I thought were really interesting. The usual, I think, is the human impact. But what was interesting to me is it sounds like there are a number of instances where you're saying the federal grant program is bringing us ideas and there's some innovation. I would like us all to think about, and we don't necessarily need to respond now, how and whether the reverse happens, which is where the local government's kind of sensitive to new and unrecognized needs, whether there are good channels for the folks who are at the front lines as a grant recipient to be able to bring back ideas about, hey, this is a new need, maybe there should be some sort of grant program in this new area, and how those channels of communication can work back. Let's move to the first of the kind of a little bit more quasi-critical, although not entirely. The focus group thought, well, gee, the federal government's often kind of on our backs about performance, and we have to demonstrate performance, and sometimes that's a hassle. Perhaps the federal folks don't really think we like being held accountable, that we just want to take the money and run. And the consensus in the focus group was that that's not the case. Actually, not only are grant recipients not afraid of accountability, they like it. And so in this instance, I think Lisa and Jessica were going to take the lead for a little bit of a presentation and then questions.
One of the things that is a point of pride and a point of pain for me is that I can take your 100-plus page RFP, NOFA, FOA, whatever you want to call it, and turn it into a 1-page logic model. And that logic model is supposed to tell you what the problem is, what the resources are, what the activities are going to be, and what the short-term, medium-term, and long-term outcomes are going to be in 12-point type with 1-inch margins all the way around. And I do it, and so do these ladies, and so do many of you who are writing grants. And it's great to have a document that gives a summary of what your program is. But it's very difficult to be able to be accountable for a full program, number one, based on that 1-page logic model, but number two, if you don't find out what the accountabilities are until you receive the award. And that often happens because RFPs or NOFAs are written vaguely and broadly, and they ask us as the proposal writer to come back with a plan and an idea and a description of what the funding application will be. But what would help us tremendously, in the opinion I think of the entire group that met, is that write a results-oriented NOFA or RFP. Give us a more concrete idea of what the funder wants to see, not just how we will deliver what we come up with as our plan, but really what does the funder want their money to do. And be clear, y'all, outputs and outcomes are not the same thing. And some NOFAs are written for outputs, and some NOFAs are written for outcomes, and yet the accountabilities are always about outcomes. They're not about the effort you put into achieving the outcomes. So that's a real stumbling block with many of the grants that we have. So just, it was a great sentence that came up. I don't know who the author was, but define the success of the program in the NOFA. That just would make a tremendous difference in our ability to produce a program. Recognize that success occurs at the direct service level. It doesn't occur at the first agency that gets the funds or at the state, and it doesn't occur at the agency that passes it through. It occurs at the end point and then works back in partnership with those other agencies, whether it's a pass-through or a direct funder. And then we'll talk about this more, I'm sure, but standardized performance measures across agencies would be incredibly helpful. We realize that that's a pipe dream. We realize that everybody has their own system, that everybody has their own accountabilities beyond our accountabilities to them. So it's not a demand, it's a hope. I am very encouraged by the potential for the cloud adoption across government agencies. I hope it comes to fruition. I know that the public remarks on it, I think, were just in October last year, so it's got a ways to go before we look at moving agency operations into the cloud, but I think that would be wonderful. So those were the basics of what our group talked about in terms of what we would love to see in terms of accountabilities back to us from the front end.
Can I interject something that's a really specific question drawn on what Lisa described? Lisa said it would be nice to have some coordination, maybe some parallel measures used in different NOFOs, perhaps even from different agencies. And let me take a wild guess that perhaps some grant recipients are getting money both from HHS, more than one operating division, and maybe from the Department of Ed. So my question is, does anybody in the audience have a suggestion about either how it works now or perhaps how it could, that HHS operating divisions and Ed could get together and say, you know what, we're both making grants to and both requiring performance metrics of the Children's Aid Society of Alabama. Here's how we plan to coordinate the performance metrics that we require they gather, because there may be some value in having some consistency across them. Does that happen? How could that happen?
All right. My old client was the Office of Emergency Communications, so while not necessarily performance measures, there is coordinated grant guidance that is put out for interoperable emergency communications. And that's really been helpful for things like allowable costs, and adopting of the same standards, which came out of the 9/11 report and adheres to the Office of 2007. So in that sense, figuring out as a grantee if there are interagency working groups that should be doing more than just being a blue ribbon panel. They can actually be talking about things like shared common allowable costs, so that way you're consistent, and performance measures and outputs.
Is there on any particular topic such an interagency working group in existence now?
Well, I would say in the HIV, and obviously HHS is the heavyweight in it, but it involves HUD and numerous agencies, DOJ, so forth. I like to say HIV has kind of been a model because they've really worked to get standardized measures at least across all programs, but how each of the different HHS octaves actually carry that out is its own issue. Because my time at SAMHSA, I was part of a group that was working with CDC to standardize the rapid HIV testing so that what we're asking of grantees that when we're, say, when you do an HIV test, is it same language, like is it indeterminate, positive, negative, so that the language is the same so that once you enter it in one system, it should be easy to translate to another without having to do all this modification, and that's part of that solution is also very IT driven too.
There's something about what Alton has said that I think is really interesting, which is he said kind of, well, we looked at a particular topic, HIV/AIDS, and my sense is that if we're going to come together around performance measures and reduce the burden on grant recipients, we either need to come together around a few topics, I'm not trying to talk about 1,000, but 2 or 3 or 4 or 5, or perhaps using kind of the customs of user-centered design, think about kind of what are the 2 or 3 or 4 or 5 major groups of grantees, and think about where is the intersection. If there's a major group of grantee that's, for example, a public health provider, perhaps there's some impact on them from Department of Education grants, from HHS grants from 2 different octaves, and who knows, maybe some NSF grants. And at that point, rather than kind of trying to tackle the world and boil the ocean, what we could do is we could say, let's start out with a pilot with these 2 or 3 or 4 or 5 kind of major types of grantees and ask ourselves, what are the conflicting or duplicative or burdensome performance metrics that apply to these grantees? And then take that user-centered design and say, well, how should we reconcile them? All of a sudden, when we've got a specific type of grantee or a specific type of problem like HIV/AIDS, it becomes clear which agencies should be part of that group. How should they then coordinate? And presumably, perhaps as well, be informed by some actual real grantees who have experience on the ground with kind of where are the conflicts? Am I being asked to report about the same sorts of programs by 3 different agencies using 3 completely different sets of metrics, trying to kind of tackle the same thing? So that's something where, again, in my mind, the purpose of this panel is to not only kind of point out what are some of the challenges, but to think through collectively with you in the audience, are there ways to tackle them? And I'm sorry, Jessica, did you want to add something on this topic?
Yeah, I just have a couple of items to kind of dovetail on what Lisa was talking about earlier. When you get to the grantee level, whether you're the grantee or a sub-grantee, the way that these items impact them, the people who are actually doing the work, whether it be administrative or whether it be the service delivery, without clear guidance and structure, a lot is left to individual interpretation, which leads to the myriad of actual versions of implementation. And unfortunately, what happens without this clear guidance and clear structure from the beginning is that using an output approach, many times the people, especially at the administrative level, they sometimes lose the purpose of the grant. So one of the things that I like to say is when I'm working with someone who is new to grants, many times they don't understand what the standard practices or procedures are in grant management generally. And they are usually left with looking at historical or archival documentation on how the people who preceded them did it. That's not always the right or the best thing to do. And then they head down a path, and then you have to catch them and retrain them. And one of the key components without that clear structure is the purpose of the grant actually gets lost in trying to meet the compliance. And one of the other things that happens often, and it's not just grants, I'm sure that several different business arenas that people have worked in could attest to this as well. If we identify that there is a gap or a deficiency somewhere, we try to fix it. But many times, we don't look at cleaning away and starting over. And many times in grants, when it comes to legislation and regulation, many times we just put more on top. So we add to what already exists, and that doesn't always fix the problem. So if we take an approach where we look at the purpose and the intent of the grant, and then work backwards on how we get there, I think that's a better focus and a better approach, and that perspective, I think, can feed through all of these different topics that we're talking about today. We're doing this for the outcome, not the output.
Any questions?
Jeff, one more thing that has occurred with some of the funders that I work with at the state level. This is not at the federal level yet. But we have a 30 to 60 day ramp up period, if you will, built into some of the funding and some of the contracts that we have. And I think that it would be very easy to immediately find a negative financial impact on that, or not a good ROI to the funder. But if you can get your team together on the front end, and that includes your grant officers and your program officers, even if it's just 1 or 2 meetings or phone calls, to go ahead and work through that strategy in the first 30 to 60 days of a funding award, so that we can tell them what we've identified as questions or gaps, and so that they can be more clear about the expectations that they have. Then my first program officer call at the 6-month mark won't all be being dinged for all the things I'm doing wrong. And then when I say I with that, but when we're reporting and we're not reporting in the format, or we're not using the right nomenclature, or we haven't called this agency and gotten a cooperative agreement, or whatever it is that they were expecting us to do. I just think that building in that cooperative period would be very helpful.
And I have one more thing to add as well. If we have a standard for measuring our outcomes, and it would be the same amongst other states and other entities that actually provide the end services to the public. If we have that, then we can actually look at other states, other entities, other nonprofits, and know that their report measurements that they're providing, that we're actually comparing apples to apples. And the additional benefit that comes through that is we can look at best practices and lessons learned and know that they are applicable to everyone. Now, with all of the competitive awards, that might be much more of a challenge, but perhaps looking at the formula grants that are the same with every awardee, and at least getting those on the same level in the same field, so that we can all become better grant managers when we're seeing what other people are doing, and we don't have to make the same mistakes and waste, the limited resources and funding that is available.
We're happy to collect the data, and we're happy to report it. We really are, but we do want to be accountable to what's expected of us.
So Jessica, may I ask, I'm going to put this in really blunt terms, does this mean that you would rather the federal grantor, for at least a block grant, say, here are the performance measures, live with them, as opposed to asking you to propose them each time you propose a new grant? And in order to be able to say we've got an apples-to-apples set of metrics across all the grantees?
Well, a block grant is a bit different. But if there is some kind of source measurement for any type of grant, it also might be easier for the grantors to review the applications and determine whether or not a proposed project should be funded with those grant dollars. Because they're, even though they might not be doing the same thing, we're talking about a measured outcome a benchmark, a benefit. And if there's some kind of structure for those applications to be presented, then the apples to apples comparison could also happen, even if it's a different project or a different outcome, there would still be a similar measurement to determine return on investment and make the decision of where those dollars should go.
I have to say, hearing what went on in this focus group a month ago, there were two facets about this topic and conversation I was very surprised by. One of them was folks said, we not only want to know when the notice of opportunity is issued, we want to know what the performance measures that are going to be used to measure us are. We want to know what target level of performance, how good we need to be. Because you know what? In some instances, we may just decide we can't get to be that good. We're not going to bother even applying for that grant. And if we also have that understanding, we know it and we're likely to achieve it, those are the grants we want to go after. The second thing I was surprised because frankly I've gotten a very different answer in asking this question from federal audiences than I heard in the state and local grant recipient group, which was folks are interested in having the metric data for grantees be available online in an accessible format. And it seemed to me like there were two reasons for that. One is because if it was an apples to apples basis, you can see how you're doing. Are you doing better than other folks or worse? And if it's attributable, you can go ask the folks who are doing the best, how'd you get to be so good? And that was something that was surprising to me, but that seemed pretty consistent across the focus group. Is that true?
Yes,
okay.
Absolutely.
May I ask again one more time, any questions from the audience before we switch topics? Back.
Have you made an attempt to do a survey from the grantees to suggest on the metrics, the reporting standardization, whatever it is, in a way to create that commonality, especially for formula grants?
I don't have a formula grant right now, do you?
So I think I might be missing part of your question.
I guess you mentioned about for the formula grants, especially could standardize, because it's pretty much constant and we could just replicate it across all states, right? Now, have you ever considered about throwing a survey across the grantees, getting the input to consolidate it? I'm talking about the reverse engineering.
So I can tell you that the state of Nevada actually has put a survey out for many different topics. It is available online. I don't have the web address written down right now, but I can provide it. And they ask several different questions. They ask questions about what the grantees want from their grantors, some recommendations from the federal level, recommendations for the state who does a lot of pass-through. And although there weren't specific questions to formula grants per se, there was a repetitive theme that was going through all of these questions. And one of the biggest asks for our subrecipients is that we have a standardization. So many entities that receive awards do not receive them from only one grantor. Even at the state level, we receive multiple grants from multiple federal agencies. And I'll go ahead and talk about it now. It'll make it faster in one of the later items that we're discussing. But as a state, if I'm receiving grant awards from 8, 10 different federal entities, not only do we have those 8 or 10 different guidelines or governance or processes that we have to follow, but sometimes we even have different processes from the same grantor. And so we end up with more than a dozen different processes that we have to follow. It makes it very confusing. And when our sub-grantees are asking us for standardization, it's next to impossible when we have 12 different criteria, and that's before we have to apply the state governance and criteria on top of it and then pass it through. So, you get this next to impossible conglomeration of different processes for people to follow, and that's one of the burdens to receiving grants. If we had a standardized mechanism, then maybe we're only dealing with 2 layers of regulation and compliance and policy, and we can at least standardize that to all of our subgrantees. That makes it easier for us as well. If we can have grantee A and grantee X sending in the same information, and now we know how they're complying and compared to each other so that we can make the business decisions on who to pass through to.
Thank you.
Gisela, could you give a concrete example of a process that you just alluded to where you can show the differences from different grant-making agencies?
So yes, our Department of Health and Human Services has put together some matrices that we are requiring subgrantees who apply to receive our awards to actually fill out the information. I will give you my card.
Sure.
As soon as we're done, if you want to see a little more of what we're doing. Personally, I think those can be streamlined as well. We all try to start with something new and we have to beta test. Some of the processes that we have used at our Department of Health and Human Services has been beta tested and it is working. And so now, as we always do, once we have something in place and it's working, then we always look to see how we might be able to improve it or streamline it even more. But we're only doing it at some of our Health and Human Services divisions. Within the last year, they have rolled it out to be comprehensive across all divisions under Health and Human Services in the state. And it's also a matrix that our state grants office provides to any recipient agency who would like to come on board and learn grant management. And we have early adopters and we have some who maybe don't even know about it or a little slower to adopt, primarily because of resources and knowledge communication, but we're on the path.
I think is there an example where from a federal agency, right? Let's say if you're receiving grants from 2 different agencies, that their expectations on the same process, let's say financial reporting or performance reporting, are different. Because what I heard from your earlier comment is that that's what is creating complexity on your part, because you don't have a homogeneous process to adhere to, right? And then, so can you give an example from different federal agencies requiring you to do things differently for the same process? I want to just make it very real because when we support our state customers, we also notice that this is a problem. But somehow I think, on the federal side, there is maybe the connection is not being made. So I'm hoping that you can give a concrete example.
Mm-hmm. I think I can.
Sure.
You're no longer with SAMHSA. But our first grant that actually came through SAMHSA to the state of Pennsylvania and then came to our organization. So that was our first grant. And in that grant, the state said they didn't know what we were going to have to measure. And we passed some money through to some partners to do some of the work. And we also told them, hey, we don't know what you're going to collect from the patients, but just, trust us. And we just put a guideline in that says, well, whatever SAMHSA says we have to do, you have to do too. So for the first couple months, nobody really knew what was to be collected. We were supposed to count patients that we enrolled, and we tried to collect, the standard demographic information and some things on just because we were interested. Are you on housing? How long have you been sober? Those kind of things that are interesting. So then, probably 6 months into the 7-month grant period, which eventually got extended, we did get the list of things we needed to collect, and now we need to do a quarterly report on things that we had no idea we have to collect. How many firemen did we educate about opioid use disorder? Oh my goodness, and even breaking down how we spent our budget between prevention, treatment, and administration every quarter. We now need to do that. Well, then another grant came to another part of the state, and so we were able to get another $250,000. But that part of the state now wants a monthly report on what we're doing in addition to the quarterly report that we're already doing. So we've got that. And now we got our direct SAMHSA grant, and that reporting is a 20-page GIPRA survey that each patient has to be administered in face-to-face on intake and at 6 months and at discharge. But it was 20 pages when we started the grant application, and you know, people are going crazy trying to put together a grant application. And I said, you know what, for the data collection, let's just say we're gonna do it by paper, we're gonna, you know, keep it locked up. Someone's gonna enter it into the SPAR system, enter each person's, we'll just do it that way, let's keep it clean and simple. I am sure that SAMHSA has figured out an online like Survey Monkey or something to do this survey. It's 20 pages long, so let's just not worry about it yet. So then we get the SAMHSA grant, and lo and behold, it is a 20-page paper survey that has to be done face-to-face, paper, and then we give it to our data analyst, who should really be analyzing data, not putting it into the SPAR system. We do that for a month, and then he goes into the SPAR system to enter some, and oh my goodness, it's a 44-page survey. It's not 20 anymore. Oh, we changed it to a 44-page survey, and there's no instructions on how to administer that 44-page survey. Now, we've already taught our partners to do the 20-page survey. Now we have the 44-page survey, and so our project officer said, well, just use the 20-page one until we figure out how to get you instructions for the 44-page one. So then last week, we got a 124-page manual that explains how to ask each question in the 44-page document. So, and quite honestly, and they added a section on a clinical diagnosis, which our recovery sports specialists don't have access to an electronic health record. So now our recovery sports specialist or our social service worker that we hired with federal grant money is going to have to go back in and look up each person's code. Now, these people were really intended to be working with our patients, not to be working in this this convoluted kind of a system. Is that an
example?
Thank you.
Let me draw a couple of interesting lessons from that. One, I don't know if very many of you noticed. First, Mr. King, I happen to know is part of the Department of Justice, no longer part of SAMHSA, but the dynamic to start with was interesting, which is, Nancy, I heard in her voice, I'm a little bit worried I might lose my grant because of this. I can't provide you honest feedback bluntly because I'm afraid for my grant. And so bluntly, in a number of federal agencies, you may not realize the dynamic, but you may not get blunt feedback very often. I think this is a good forum. The second thing, not everybody is aware, but there actually is an organization that's kind of informal of chief state grant officers. There are 50 of them, along with maybe some others from like DC and Virgin Islands, Puerto Rico, etc. They are informal. A number of their members have actually come and spoken at this forum. So Carol Cross from Illinois, Lori Patron from Rhode Island. We can help you put you in contact with those folks, and they can provide feedback, and they are probably a little less nervous about offering feedback to the hand that's been feeding them. And then the last piece, what I think I heard again was a federal agency, in this case SAMHSA, I'm not sure, I don't see anybody I think is from SAMHSA in the room, but kind of not taking a real user-centered approach, simply taking what is it that I would like in an ideal sense to be able to evaluate this program, and legitimate interest and concern, but not really stopping to think, perhaps some of the data is already there in an electronic health record. Perhaps we could get this in a much more effective and reliable and less burdensome way. And so that choice essentially is something that it sounds like that's a perfect example of what is grantee burden. It's all in good faith. This is information we want about how we're helping people who have opioid addiction issues, but it's causing someone to get out of the health delivery and health care and health analysis business and into the data gathering and data entry business, which seems to me like exactly what we're trying to think about how to minimize.
It's killing a lot of trees.
Indeed.
It's killing a lot of trees, and that certainly is not the intent of all the Paperwork Reduction Act.
Okay, so the next topic, and I'm realizing we have some time constraints here, I'm going to try and keep us moving. So this topic is a sense that a number of federal agencies say, hey, we didn't actually get to this on time, or we've got a legislative deadline, we need you to respond quickly, can you get us back this information in 48 hours, grantees? And they may say that to all their grantees, and then ask for it back in 48 hours. And so we had some reaction to that sort of a situation, and Nancy, I think that you were going to talk a little bit about that maybe.
Sure. continuing on my example. But you're right, Jeff. At our larger group, almost everyone had a story or an example of perhaps the grantee definition of timeliness is not the same as the grantor's definition of timeliness. There seem to be some inequities. In our situation, I was so excited to receive, and I might as well tell you it was the SAMHSA grant in September to start. It started September 30th, but one of the special conditions was that I had to do a budget revision by October 31st, and this was new to me. This is my first SAMHSA grant. Do we always have to revise the budget even though we just wrote it, and I knew what I was doing when I wrote the budget? So I revised it to take salaries down because I knew it would take a little longer to hire, and instead I put it in a bucket called technical assistance because they said I could have $25,000 worth of technical assistance even though they didn't define what that might be. Mm-hmm. So we sent it in, it's in, I can see in the system, which is great. The REI Commons system's great. I can see that it's in there, it's under review. It was under review for 5 months. We received the new notice in April. So I would assume that my second budget, which was very similar to the first budget that I submitted, was okay, because now the special condition is removed. But then back in January, I had a question about salaries, because we did hire someone in at a higher rate than I had in the grant. And so I posed the question to the grants management specialist, and that was January 31st. On May 14th, I got an unread notice from that person. But I know he still works there because a week later, he asked me for something that was due within, and he wanted an answer in 5 days. In addition, Easter weekend, interestingly enough, some of us checked our email Easter Sunday evening, and our project officer had contacted us at 11:30 on Good Friday night, asking why our performance numbers in where we were entering the 44-page surveys, why they weren't higher. And he wanted a plan of how we're going to make sure we meet our deliverable, and he wanted the plan by close of business on Easter Monday. So you can see, is there some kind of a standard of a timing? We understand that the federal agency, you have multiple grantees. I also have multiple grants. So is there something that's reasonable? Just tell me you're out there. Tell me you'll get back to me in 3 days. Tell me, are you even there? Don't wait for the unread receipt to come. But is there maybe like a standard of 30 days? If I don't hear from you in 30 days, should I assume that what I asked is okay and proceed? Because if I had waited 5 months to see if my budget was okay, I wouldn't have any numbers in the performance section.
And I just want to make a potential suggestion. It seems that I hear over and over similar stories. And one thing that seems to be a common thread is when we reach out and contact our liaison from our grantor, that's exactly what we're doing. We're reaching out and contacting our liaison. If there were some way to have a standardized inbox or voicemail so that if your liaison either has accepted a different position or they're on vacation, there might be some way to kind of triage and have someone else in the office that also understands the grant assist, and that could also free up some of the burden or barriers that we come across.
And we have a monthly team call with the program officer at the regional level, who is basically our first line of contact for our federal grant. And we've been doing this for about 18 months. It's actually an improvement in the communication that we were having up until that for the 18 plus years of this project before that. So that's a kudo. That's coming at the end, but we're happy about some of the progress that's been made in terms of the relationship between our agency and our funder. We have somebody, and I do get read receipts from her, but what happens most often is that I get the agenda for my monthly call either between 10 p.m. and midnight the night before or as we're dialing into the call. That feels like a gotcha. I'm sure that she doesn't intend it to be that way, but it feels very uncomfortable to be completely unprepared for a call with your program officer. And it's this way every single month. And so I do have the opportunity to give feedback in a, personally, I'm okay if it's not anonymous, but I do have the opportunity to give feedback about that and ask that that be maybe altered. I recognize that she has a lot of grants to manage, but again, when you go into that monthly call with that little worry, that feeling of, I'm going to get hit with something and I don't know what it is and I'm going to be cold on my feet to try to answer it. For me, as the grant officer, I'm better prepared for that in some ways, but when the service team is in the room and they get hit with a question that they have had zero opportunity to try to research or prepare an answer for, it just feels like you're starting, with your heels back.
So I realize there may not be federal agencies who want to offer feedback on this topic, but if anybody has questions or is interested, you're welcome to raise your hand.
Oh, I can provide feedback. So it's funny, the role of project officer. I was a project officer for CDC, overseas PEPFAR funding. So it was a very different reality for me when I came back stateside and being based here. I had 45 grantees to manage and I was supposed to do a monthly call. I was like, there's no way. And I'm gonna be honest, I never did it. I just let people reach out to me because I just couldn't figure it out. But I definitely appreciate your feedback because I know with the grants management specialists, at least at SAMHSA, they have 170 grantees that they're looking at any one time. But the triage thing, there is a group email that's used. Unfortunately, not everybody knows how to use that properly because it's like, yes, I get this email, but if you get 300 emails in a day, people kind of, ignore it. But I'm certainly not excusing it, but it's good that you all provide that feedback to the staff because they do need to hear that to see what can be done. It's honest feedback.
And I think getting back to what Lisa said was that if at the beginning when those kind of things are due, you're sending stuff that's due, if you can get even a smaller cohort and do a couple of different group calls and talk through some of those things, that would save your inbox and your phone calls.
I'm curious, how many of the federal folks in the room are aware if your agency has a grantee satisfaction survey? Kind of like customer satisfaction, except grantees?
Yeah, for sure.
At least a couple agencies.
Take it very seriously.
We do.
Good. All right, let's keep moving. So the topic here was IT systems, and again, there was a kind of an initial thought to be critical, but then a thought that, actually some things are working well, and let's see whether or not we can move towards improving them. And so in this case, I think, let's see, Jessica was going to take the lead.
So we've already touched a little bit on the multiple systems. This topic I kind of see as like a two-pronged topic. So we have the IT systems on the federal side. Pretty much everyone in the grants management world is aware of grants.gov because that's where we have to submit our applications. And in some cases, that's the only place where we have to submit our application. In other cases, we have to take that same information and re-enter it into a different system because another agency uses a different system, and even though we have to put it into grants.gov, we have to re-enter it into ERA Commons or any one of the other dozen-ish or so systems that exist out there. So I know that there was conversation earlier today that there's a data standards that's being put together, and so that's kind of one of the recommendations that I have is if there were standards and platforms that we were aware of, that all of these different, because putting everything in one system may not be possible, but if you were able to use a standardized platform where all of these different systems could communicate with each other, it would be so much easier to track a grant from submission for a grant request and a grant award, and then you could track it and follow it from the award to approved budget, to budget amendments, to reporting, to closeout. And if you can, I'll throw the term blockchain in here, even though we're not using the blockchain method, if you can actually daisy chain and follow a grant from concept to closure, your data is going to be so much more beneficial because you're going to have a higher level of accuracy. You're not going to have 20 different points of keystroke error or human error or duplication of effort, where you have the same person entering the same thing over and over in different systems, putting information into the wrong field because the fields aren't compatible with each other. So that's the first side. The second side is we are in the 21st century, and as Nancy was talking about earlier, they still have some information that they have to provide on paper. Okay, what kind of level of confidence do you have in the data when it's on paper? Is the same account looking the same on 2 different days based on that? So that's one question to look at. But technology and electronic data is not going away. And with that, we have been able, people in general, when I say we have found ways. We have an app for everything now, right? So we are using technology. Data analytics is a hot topic that is being discussed. And so technology is not going back in time, it is constantly progressing. And with that, we have found ways to streamline processes and be more efficient with our time. Although there might be additional upfront costs, in the long run, there should be administrative burden reduction in cost if you are able to implement technology. So one of the topics that we talked about with technology being here is the ability for people to propose in their budgets a line item for technology maintenance or adjustment on the systems that they might already have. And in many, if not most grants, technology is not even thought about. It could come about in different ways. It would be an administrative cost unless it might be end user facing. But if there is provision for people to propose system improvements or adaptations to accommodate and better manage and be more efficient with the grant dollars, that also might be a reduction in burden for sub-grantees or grantees.
Great. Any questions on this?
Going back to the last comment, right? If I, maybe this is my interpretation from an IT dashboard, there is a line item, federal financial assistance, and they appropriate the dollars for IT purposes to solving problems like that. That's what I was anticipating. I'm not sure how this is being used.
So in my experience, and my experience is maybe a little more limited than some others, there is federal financial assistance for broad-based systems. If this is what you're talking about, where I'm familiar with it in Health and Human Services, where they have all of these different programs and kind of accommodating Affordable Care Act and information technology, where they could combine larger systems. But I'm talking about things, for example, text message, text notification reminders, you need to reapply for your grant, something like that. That's still considered a technology cost, which doesn't necessarily fall under the consolidation, but it saves administrative time because you don't have to have a person calling Nevada is not a large state as far as population is concerned, but we still have, from one program or another across all of our agencies and all of our services, we have a large percentage of our population that actually receives some type of service. And we we don't have the manpower to send out letters or to send out, make a phone call, or we don't have the budget to accommodate the stamps and the envelopes. And so if we were able to bring an additional technology like that into place, it could be automated, it would save a lot of time, and everyone who is receiving services get the reminders that they need to continue receiving the services or update their application, and all of that could be accommodated outside of the financial act that you were talking about.
Thank you.
And I just want to give you the opportunity. Is this also being able to allow the maintenance and operation costs that are so often not allowed in federal grants?
Potentially. I mean, that would be a decision from the grantors, but I was floored. This is just to show, I tell people all the time that I'm old school. So I was kind of floored when I walked in with my really pretty special edition iPod that I got for Christmas 7 years ago. And the battery was expanding on it, and I walked into the Apple store and I'm like, this is so beautiful and it has all my music on it and I need to get the battery fixed, and they're like, what is this? I said, it's an iPod. And they're like, this is vintage. I'm like, vintage has to be over 20 years. Well, that's not the case in IT industry. So operation and maintenance, I could see might be a gray line, because in the grant realm that normally isn't covered, but when we're talking about IT systems, everything changes so quickly that we have to, even Microsoft 7, which so many people have been using, will not be supported. They have extended the support and extended the support, but we're actually risking our data integrity and attacks when it's no longer supported, and whether we like it or not, we have to switch and we have to change. And so IT might be one of those things that is progressing so quickly. Does it conform to the standard definition of maintenance and operations, or is it actually a different type of service, providing service to the end user?
One of the things that I heard in the focus group a month ago, it's not surprising in retrospect, although I wasn't expecting it, and that is, we asked the 25 folks in the room, essentially, are you happy with your own IT system? And a few hands raised, but not very many, and some of them are pretty much on paper. And so then we asked, well, does it make sense for each of you to go out and kind of spend the time and energy to find and choose and buy and learn to use and then start using a new grants management system? And they said, well, we haven't made it a priority so far. We really like it, but we can't afford it. And in part, that's because the grants don't cover that. That's the administrative cost. And so then I asked a question, what would happen if a federal agency gave you a kind of a menu and said, here are some that we negotiated and here are some choices you could make? And they said, well, that would be better, but we'd still like the federal agency to pay for it. And so then you kind of think about that a little bit with, well, the questions about maintenance and operations. If the federal agency said, we're not going to choose one winner, we're going to choose 3 options, and let's pretend they're going to be user specific, so let's pretend they're for universities, then the universities kind of get 3 options, and the federal government pays for it and perhaps puts it on the cloud, then the maintenance and operations kind of happen, or at least the maintenance happens on a routine basis. And that seemed to be something that was pretty popular, with, of course, the strongest part of that being popular was the federal government pays for it. But I did find it interesting that it seemed like a significant majority of the folks present said, if the federal government pays for it, we assume it will significantly improve our capabilities and at the same time improve the quality in the data and our ability to comply with the federal requirements, even if they change. Because presumably, if the federal government selects 3 vendors for universities or maybe 3 vendors for, education agencies, we'll be willing to live with that. We'll choose which one of the 3 we like best. So I was surprised that there was a willingness to accept that kind of level of federal intervention, but of course it was presuming that it comes with the federal funding. Was that consistent with your all's recollection?
I think so. My agency is very, small in relation to these 2 organizations, but speaking for nonprofits in general, Most of us have donated equipment out of somebody's garage, or the computer that the college graduate doesn't need anymore, or whatever. We have a lot of donated, incompatible, separate pieces that are held together with Band-Aids and duct tape, and you know, and as a nonprofit, the technology and keeping up with the current level of equipment available out there can be just so cost prohibitive that you do a lot of things manually, which is, you know, the least preferable way to manage your data. Talking about Windows 7, our agency of 76 staff and about 110 computers in various iterations has just spent the last 18 months upgrading every single individual, and buying 110 Windows 10 compliant laptop computers and moving the entire staff to that is an incredible investment for our agency to make, and I didn't have one funded dollar to do it with. So it really does become prohibitive. But if the agency or the funder requires that we are able to share information, we've got to have the equipment to do it, and we've got to be able to up that equipment once we've acquired it. So having the federal government bridge that gap somewhat would be tremendous.
We're going to move on to the next topic, which
Can
was...
I add one more comment to the David Thompson National Council of Nonprofits? Lisa's absolutely right. Every single nonprofit in America has this challenge, especially with government grants, not just federal. Connecticut is notorious for completely changing computer systems and changing them again. You have to pay for it each time. Sometimes private grants, private foundations will fund technology. There are organizations that are starting to realize this problem. Gates folks ought to do more. And so we are working, it's a perennial problem throughout the nonprofit community, especially frontline nonprofits. Every bit of help that states can give, every bit of states the federal government can do in terms of support, in terms of recognizing, changing the indirect cost rates, and recognizing all these challenges through guidance, et cetera, is greatly needed.
All right, so let's move to technical assistance, and we may have to kind of reduce these from 10 minutes per topic, maybe down to 7 or 8 minutes per topic. Better ways to do technical assistance. What is the feedback on that, Jessica and Nancy?
So I think I can keep my portion of this one pretty quick because I've added some of the statements in earlier. Resolutions tend to be additive rather than incorporated or integrated. Just as an example, one thing that I always use is if you're looking through a window and there's a crack, do you replace the window so that you have a window that you can see through, or do you cover it with duct tape? You're not resolving the problem. So you get another crack and you cover it with duct tape, and pretty much you're looking at a window that you can't even see through. It's not even serving the purpose that it's there for, and at some point you're going to have to replace it. So with the going back to guidance structure, I think the more information and the more guidance that we have at the beginning, we can start the project collecting the appropriate information that we know we're going to need instead of backtracking, and sometimes not even having it. This also feeds into accountability. If you know what you're looking for in the beginning, you can hold us accountable for actually delivering. But if we don't know what you're looking for and you don't know what you're looking for, where is the accountability? And so the technical assistance could be done in many, many ways. We were already talking about having conference calls, having certain things, but the more structure we have from the beginning, before the application is even submitted, the better off we are. We know we're headed down the right path instead of taking a detour 5 miles out of the way that we don't even realize is happening. And one of the comments that came up in the group is that contracts and cooperative agreements tend to have better technical assistance and guidance than the grants do, and by definition, that may be why, but maybe we can take some lessons from that area and those different types of agreements that we have and see what might be applicable to grants.
You know, that might draw kind of from the earlier theme of the grantees wanted clear information in the notices of award opportunity or notice of funding opportunity, where they said they want not only performance measures but also targets. Now they're saying they kind of want more specific technical assistance and kind of more specific expectations. The other thing I recall hearing, which I was quite impressed with because I thought it was a really different idea, was technical assistance often comes from federal employees or from federal contractors. And one of the things I heard amongst the grant recipients during this focus group a month ago was, you know what? Peer-to-peer communication really helps because these folks have been down this same path themselves. I'd love to hear from them. And what that made me think is there are a few informal networks. National Grants Managers Association is clearly one of them. But that could be an area where a federal agency, rather than engaging a costly technical assistance contractor, could work on creating and promoting and helping care and feed for a peer network of grantees who can solve each other's problems instead of relying kind of on a paid consultant to do that. So I thought, you know, that's an interesting idea. It's different. I'm not familiar with it happening. It probably is more economical than consultants. And Alton's already going to prove me wrong and say it's happening all over the place.
Well, I know because when I had presented at the National HIV Conference in Atlanta, I had visited my grantees in Atlanta, in Augusta, and Macon, and I was like, oh, there's 5 of you all. Why don't you all have a cohort? Oh, Cobb County. So I went back, put in a TA request in our system, and we worked with AHP, and so they found some experts, and because our travel budgets are quite limited, so I had to piggyback on the conference that I was presenting to even be able to go see all these grantees. Without that, I would never have seen them. So using the TA contractor, they went and spent more time with each of the grantees. I had a conference call before to kind of inform them of like, hey, this is an idea, what do you think? I certainly got feedback from a couple that I'm concerned about that because they also saw each other as competitors. I was like, well, you have a greater purpose because you got the potential to change a life. And a lot of people bought into that. I mean, because you all are doing actual work. I'm just a representative giving the money. So long story short, it really worked for them, and once they had their first meeting, it was like, but then by the 3rd or 4th, they were like working on their own, tackling each other's problems. Because I thought it was very helpful, like you were saying, Jeff, the peer-to-peer. You're speaking at ground truth of some things that I may not pick up in my monthly conference call, or maybe I can only see when I'm doing a site visit, whereas you all are living and doing this every day. So I definitely support the peer-to-peer model.
Yes.
A quick comment and a question. So, yeah, absolutely to peer-to-peer models. It's a substantial component of at least within elementary and secondary education at the Department of Ed of our TA, and we do get positive feedback from grantees on that. I'm hearing a lot of requests for sort of additional prescriptiveness, and I'm wondering whether you think that, as the grants administrator, that is appealing to you, and how that fits into your broader context as a state or an organization, because we've been pushed to be more and more flexible, which limits how prescriptive we are expected to be. So I don't know if you have any comments on that.
So I was actually thinking about what you were just talking about earlier when I was listening to Nancy's example. So when we're I don't think we're actually saying be more prescriptive from the standpoint of how do you do things. This ties into the outcome performance measures rather than the output. So when I hear the word prescriptive, I naturally relate that to tell us what you're doing rather than how are you meeting the intent of this award. So when we're talking about having structure and matrices, it's not necessarily about how you do it. It's like, this is what we want the outcome to be. And if you have a clear idea of of the vision and the mission of the grant award itself, that is the structure. We're focusing on the intent of the grant itself, and it still allows the flexibility of the business operation to determine how do we get there. And that is where I see the flexibility coming in. When we're asking for technical assistance, I think for the most part, unless someone is new to grants or they don't quite have the experience of managing grants, when we're asking questions, we're really looking for outcomes, and maybe the information that we're getting is related to outputs, and so that's how and where and why we shift to measuring the regulatory compliance rather than what we're actually doing in our service delivery. Does that answer your question?
I think it does, yeah.
I have one more story on technical assistance. I thought technical assistance was basically what you were describing. My first experience with it was with a Robert Wood Johnson Foundation grant, which was a long grant. They used George Washington University people to provide the technical assistance. So we had opportunities. We had $25,000 in technical assistance money to have someone train the trainer to do motivational interviewing for across our entire system. We had someone for another $20,000 come and work on a sustainability plan for us, provide the technical assistance for that. So when I put money in the SAMHSA grant for technical assistance, and I knew that we were struggling with how to do these paper surveys, there has to be a better way, I was thinking, why don't I get data collection technical assistance? So we start the grant, and I keep saying, don't worry, we have technical assistance. I will contact the project officer. So I did, and I was sent to a 2-page brochure. It was a link to a 2-page brochure. Only 2 of the offerings on here apply to my grant, and both of them are to teach you how to set up your opioid treatment programs or recovery support programs, which I already had to articulate in the grant to get the grant. So, I was really surprised and disappointed, and I was glad to hear you talking about what I thought technical assistance was.
I understand that they've changed, because the way SAMHSA used to do before this administration is that it was a separate contract, and so we managed it ourselves. So if you had a need, or in my call with you, like, oh, well, I think you need some assistance with follow-up, you need people need more on sister or motivational interviewing, I could put it in the system and then it would work that way. Now, with it being incorporated in the grant, you have to kind of anticipate your need as part of the application, and then there's that. Yeah, it's a very different process from when I was there, unfortunately.
Well, we are often writing to the scoring section of the NOFA, let's be honest. If you get one that says how it's going to be scored and some of them do. Some of them are very specific, and quite frankly, the scoring method or the scoring statements don't necessarily match what's in the rest of the document. So you have to make a decision. Do I write a narrative about the program delivery, or do I write a narrative that's going to get me the highest score? And that can also conflict with the purpose of the program.
Okay, we have about 16, 18 minutes left, and we have 3 more topics, although they may go, at least the last 1 or 2 may go quickly. The next topic is that a strong dose of kind of user-centered design would be beneficial to think about compliance requirements. And Lisa and Nancy, I have your names here.
I think my example pretty much was the survey that just was not very user-friendly. My only other example was just from the RFP package, and we've talked about not having clear expectations of what we're going to measure. But I've also noticed that some agencies have a very logical format for their RFP. You understand what you need. There's a checklist at the beginning that you can look at and make sure you check it off. And then other agencies, it just seems to be all over the place. So, for example, you get to section D in the narrative and it tells you to go look at Appendix E to tell you what to put in section D. And then as part of that, you need an attachment F that contains some of that same information in the application package. So when you're trying to already herd cats to write a grant, when you start talking to them about, well, why didn't you do section D? Well, didn't you look at Appendix E to look at how to do section D? It does get a little bit cumbersome and challenging. So I just wondered, some are laid out well. It would be nice if there was more of a similar format for the layout.
We've also kind of referenced some of the technical things that we'd love to see. You know, our information is in our SAM account. Let's find ways to cross-populate documents. You know, let's enter the information once and have it come in where it needs to be. Just, you know, save some keystrokes, save some time, save the possibility of bad keystrokes, especially on numbers and things like that. But also, if it's a technical proposal, give us some definitions of some of the technical specifications. There are times when we really don't know what the funder means by a particular description of a delivery of service. So you can just give us a little idea of what you're saying. I'm sorry, I'm going to completely blank on giving you an example of that. But you know, if they say, you know, that they want a particular deliverable, then we just need to understand what that deliverable is. So that's really, I mean, we've talked about the uniform guidance. It's there, it's cumbersome, it's helpful, it's also, you know, sometimes raises more questions than it answers. So we appreciate that it's there, and we appreciate the efforts that's being made to keep it, to bring it current. But
and it's interpreted differently
by everybody
at different agencies.
Yeah.
I'm going to pull together a string of a couple of different things that you mentioned, as well as some from a month ago. And that is, it might be useful, again, to start from a kind of a user-centered perspective. So take the perspective of a local law enforcement agency, police department, or of a children's services organization. And at the federal level to say, well, let's take that perspective and then let's maybe start with a kind of a zero-based compliance perspective and say, what do we need now? What will we need in the future? And how can we make that into a rational set of compliance requirements for this particular kind of user? Now, the last part that was very clear during the discussion a month ago is, you know, some of these things aren't in control of the federal agency, they're in the law. And there was a recommendation that, you know, there may be occasions where we need to concertedly ask as a grant management community for a change in the law in order to be able to make the burden reduced and rationalized. But that perhaps that should happen, again, on the basis of the user, the children's services provider, or the law enforcement agency, or the local education agency. Again, there was some thinking bluntly in the room a month ago. It's unlikely that you're going to be able to get together a large group of grant recipients who have enough time and money to think about this. It's not likely to go very far unless some federal agency takes initiative. And even there, especially if it's going to cut across federal agencies, the odds that you might find, for example, just on a random basis, that for Veterans Health, you get VA together with HUD and with HHS and perhaps even FEMA to cause that to happen, that coordination to happen. And clearly the reason that coordination did happen was because there was kind of a central priority setting that said, we need to bring together different federal agencies on this user-centered perspective. So that's happened in a couple of areas, and Veterans Health and Housing clearly has been one of them. I think the thing I heard from the focus group a month ago was, you know, maybe that ought to happen in several more areas, and from the perspective of kind of the grant manager and the grant recipient based on the program and or the type of service provider. Is that fair? Okay. Let's move. The second to last topic is, originally they said something along the lines of, you know, grant managers need a union. But it wasn't really that strong. What it was, there needs to be both a place to collaborate and figure out how to learn from each other, and to a certain extent, an organization that could help carry the water and advocate for that change in law, or advocate for that change in regulation. And so in this case, I think we had Nancy and Jessica as names next to it.
I think we've kind of talked about it a little bit with even with the technical assistance and the beginning phone calls, a forum for even just the grantees that have your grant, maybe in your region, to get on the phone every quarter and talk about what are your challenges and how can we address those. So that kind of a forum, as well as the sort of unionized grant recipients that are looking at the more bigger picture.
And this also ties back to the previous topic, the user-centered design. Earlier, we also talked about how many times a problem is identified and we as people tried to resolve it through legislation, regulation, etc. And many times, it seems that's where it ends. We have given you the guidance. Go forth and do, it's all fixed now. And in reality, everyone's trying to figure out what it is they're supposed to be doing, and everyone has a different interpretation. So when legislation and regulation is implemented, if there's some way to follow up and find out what that actually means, what that actually does, and how it's implemented, not only at the different grantor levels, but at the grantees who are actually facilitating the end work being performed. How does that impact? Did the legislation and regulation work? One thing that is a big focus in our state right now, and I have heard at other conferences and meetings that I've been to, there seems to be a business focus on project management. So if there's some kind of centralized focal point that can kind of be the intermediary, okay, this is what the legislation says, and here's what the end users are going to have to do to implement it. Let's put a plan together of what this process is going to look like. That may be a way to help standardize processes across agencies. Open communication and collaboration, one of the other components of this that I see. We were having conversation earlier. One of the big things over the past couple of years has been how to blend and braid your grants. But the barrier is silos, and we all do it. We have silos at the state level. Pretty sure there's silos at the federal level. There's silos in every business industry. It's not limited to grants. And when you have people that operate in their silos, there are many opportunities that could be used for match, MOE, cost savings. An example that Jeff was giving earlier, if you have a grant and a project with HUD and you also have one with veterans, if you have a forum where you can collaborate and discuss and find out what's going on, you might be able to find partners with other grantees where you can actually join forces and get twice the impact for the same amount of money that you have. And that is something that is aspirational, but not impossible, and it would take some time. But I think would, in the conversations that we had, would be a benefit for everyone. It would be a benefit at the federal level, at the grantee level, and absolutely at the recipient level. Not the grant recipient, but the program recipient. Because the more that we can work together and get a better impact for our dollars, the more benefit the person can receive, because less is going to disparate administrative costs at many different levels.
I want to also put in a brief plug in terms of kind of collaboration forum. The National Grants Management Association does, I think, a good job both in terms of getting people together for conferences and training in a variety of locations. They also provide kind of a bulletin board and forum online Their chief operating officer would have been here today, except she's getting married, so she decided she would stick with that plan at this point.
Yeah, Jeff, I also want to add, the Grant Professionals Association has an equally as active board, so I get them every day, and there are lots of members who are both in information. And what's actually really good, if you can't afford to be a member of both organizations, is the tenor of the conversation can actually be a little bit different, and you can actually kind of maximize it. People share best practices on it, and it is a one of the strategic goals of the National Grants Professionals Association is, even though they're based in Kansas City, is to have more of not lobbying because they're a 501c3 effort, but of an influence. And the other thing I've noticed over the years is, you know, I came up through kind of the emergency management community, is that the legislative changes often have to happen not from a grants manager's perspective, but from like your industry focus group. And so that's where you would see like organizations like Incura and GPN and GMA almost need to influence those industry associations to make that effective change.
Okay, and one last topic we wanted to kind of round out on a high note as well, with actually some specific call-outs. There were a number of folks in the focus group a month ago that said, you know, this agency's really doing a good job, and here's something specific. We'd like other agencies to do this too, but nevertheless, we thought it would be a good thing to kind of close out with. So Lisa, do you want to offer that?
I will. The food chain on my federal grant goes from HHS to ACYF to ACF to FISB to RHY to RITEC. And I will tell you, that's it. And then I answer to them in the reverse order, back up to the top. But what I want to say about that, and I'll start with it as from the HHS perspective, is that in the last 18 months, I mean, I can almost put a finger on the date, for our particular funding stream and our particular service, we have had incredible response at the agency level, starting with our local region and particularly with the technical assistance that RITEC provides to agencies that serve runaway and homeless youth, which is part of the services that we do. I cannot commend them enough for how responsive they have been, and for the training that they offer, and for surveying, and for responding to the comments on the survey. One of the things that we asked for at our agency in our regional meeting last fall was peer support. We wanted to have more opportunities to talk to our peers, and they put together a meeting and they got us together. And we just had a second meeting in May. And for a program that's small, which we are relatively small in the scheme of things, we're one of 10 that are funded nationwide in this particular area, just talking to the other folks and seeing how it's going for them is huge. We may not all have our programs designed identically, but our funding comes from the same place, so we're managing the information in the same way. And it's been incredibly helpful to us for that. So I do commend them and hope that other agencies are doing that as well, because it really has made us more comfortable, even though I don't get that agenda till the second the meeting starts. But other than that, it has been incredibly helpful. Also, I think that the pressure has lessened on the annual or biannual site visits that we work with, in that we are getting much more, we are able to prepare better for those meetings because the agency basically tells us what they expect when they come to visit. So they have improved the site visit process tremendously, and we're able to be very responsive and not feel like we're scrambling to meet the information when they come to see us. There were some shout outs, and y'all may have more to say about that, but to the OMB, uniform guidance, and the one thing that I feel came out of the group experience, we shared a lot, and even though we were in very disparate, 25 people with very, very different funding and connections, we all wanted to do it right. And right may look different to each agency, but we're willing from our side to make that partnership work. But it also sounds like it would be absolutely terrifying to be a new grantee right now in this world. I mean, we have experience. Everybody in this room's got experience, but think about what it's like. It's going to be like for the first time, or in the environment that these grants are in right now. They could definitely use some support coming in, because I just can't imagine starting from scratch right now.
And just to echo, we do like the uniform grant guidance. Wonderful step in the right direction that does encompass all of these different topics that we're talking about. So the topics that we are talking about are demonstrating how it looks in reality at the time being. And I know that we're making progress, and everyone that I have spoken to, even at the federal level, everyone is still moving along with making progress. I've worked with several projects where we have had a lot of great technical assistance and guidance. And I know at the federal level, just like the state level, the nonprofits, resources. We tend to get more feedback from the agencies and more support from the agencies that have budgets. The ones that don't have budgets, we realize that you do have limited resources. And because of that, I think that's a little more along the lines of what we've been talking about. If there's some way to standardize at least some of the processes, it might also relieve some of the burden at the federal level for the agencies with the limited budget as well, and still make it an effective, efficient program.
And I would echo the enhancements to grants.gov. I think we had talked about that in our group. And ERA Commons, I think, is really well done at this point, and we especially like that there are videos that tell you exactly what to do for each of the steps, and they are very well done. So we really, really appreciate that.
And if anybody, has anyone in here had the opportunity to be in on some of the beta reviews on the changes grants.gov is looking at? I've been involved in that for the last several months, and I will just make a very optimistic statement that changes look like they're coming in the online process, and I am very optimistic that it's going to be a smoother process, and that there is a concerted effort to make that online experience better.
Great, so let me, on behalf of all of us, thank you both for sharing your perspectives with us, and thank you for the work that you are doing towards really important public missions. So please join me in giving a round of applause. I want to say kind of one or two other quick things as we close out. We do not have a final schedule of presentations for the fall, but we have a couple of topics. So, for example, someone from HHS has offered to make a presentation on indirect cost rate negotiations, both on how federal agencies can do it well, and to a certain extent offering some hints perhaps as to how grant recipients might be able to do a better job negotiating on their own behalf. Someone from FEMA suggested they can offer some ideas about providing technical assistance kind of for inexperienced grantees who might never have received a grant before but might be facing a compelling need in a disaster. And then one last thing, so many of you are perhaps familiar with, we've done an annual survey of grant managers for a couple of 3 years now. We're about to start an annual survey on analytics, and there's some intersection where grants analytics come together, but we hope that if you all are interested, we'll get you an invitation and you can respond to that survey.
And I just want to say thank you very much. This was so informative. This makes it worthwhile to get up early and to worry about the logistics when you learn so much from people who care so passionately about what they do and are so thoughtful about it. I am very grateful I was here, and I thank you very much. Thank you. Thank you, everybody. Oh, this was great. Thank you. Thank you so much. Thank you. Oh, what a great idea.
Thank you. And I'm on Pacific time.
Oh, you're just getting less.